Hi, welcome back to Gentle Physical Therapy. In the last video, we focused on breathing and getting movement through the breath. Now we're going to focus on introducing very gentle exercises. All you're going to need is a comfortable place to lay down, whether that's the floor, the couch, or the bed for you. If you have a connective tissue disorder, this exercise is going to be part of step 1. This is coming straight from the Muldowney protocol, which is geared towards living with Ehlers-Danlos syndrome. Physical therapy treatment should always begin with the sacroiliac joint, whether or not it is painful. You have a right and left SI joint, which can be located by finding the dimples of your buttocks. If pressing on the dimples of your buttocks causes pain, you may have an SI joint dysfunction. Supine abdominal bracing. Lie on your back with knees bent and feet hip-width apart on the mat. Bent knees, feet hip-width apart. You'll want to find pelvic neutral. This is defined as a range of motion somewhere between the low back being fully arched and fully flattened, in which the position does not hurt. This is different for everybody. Find pelvic neutral, then take your hands and place them on the front part of your hips. Find the 2 bumps of your pelvis. That's right here, that bone. From the bump, move your hands 1 to 2 inches inward toward this midline. Press your hands into your stomach and laugh. So go ha 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 right here. That contraction you feel under your hand is your transverse abdominis. If you feel this muscle contracting, that means that you're in pelvic neutral and you're ready for the next movement. So to perform the bracing with the pelvic neutral, you're gonna go ahead and pull in the muscles underneath your belly button and hold that for 10 seconds. Don't forget to breathe and make sure that your butt is quiet. By quiet, I mean don't tighten your butthole. You want to be focusing this exercise in this area. If you're going by the book, it says start with 1.5 minutes and add 10 seconds each day until you reach 3 minutes. And then once you reach 3 minutes and can also do the other exercise I'm about to explain in part 2, once you can do both of those exercises for 3 minutes in the same day at the same time, then you're ready for the next steps, which will be parts 5 or something. I have a lot of other gentle areas that I want to address before we get into the higher levels of physical fitness, because I'm really not there anymore. Depending on where you are in your pain journey, that could be all you're capable of doing. That's where I started, and honestly, after I was attacked by a dog this summer, that's back where I'm at. And I've technically been in physical therapy for almost exactly 1 year. Progression of this must be based on what you can tolerate. Like and follow for more gentle physical therapy exercises. I hope these videos help. No matter how much you want to get better right now, don't push yourself too hard. If you try to do these things and then you flare up, either right after or in the days after, back off a little bit and do a little bit less, so that way you don't overload your body and then be useless for however long afterwards. Believe me, I have a problem with that. Drink some water. It's good for you.